laboratory findings. Blood tests are key.
Okay.
You're going to look for decreased serum calcium. That's both the total calcium level and, perhaps more importantly, the ionized or free calcium. That's the biologically active form.
Low calcium, check.
At the same time, you'll usually see increased serum phosphate, the hyperphosphatemia we mentioned.
High phosphate, check.
But here's the crucial piece, the linchpin of the diagnosis, the parathyroid hormone level itself, the PTH level.
Right. What about it?
In true hypoparathyroidism, the PTH level will be either frankly low or, and this is really important, it might be inappropriately normal.
Inappropriately normal. How can normal be inappropriate?
That's the key. If your blood calcium is low, your body's normal response should be to crank out lots of PTH to try and fix it. Your PTH level should be high.
Ah, okay. I see.
So if your calcium is low, but your PTH is low, or even just in the normal range, that's not a normal response. It's inappropriate.
Yeah.
It tells you the parathyroid glands themselves aren't responding correctly. They're the source of the problem.
That makes perfect sense. So a low or normal PTH when calcium is low is the smoking gun?
Exactly. That's the hallmark. Beyond those core tests, you'd also typically find decreased calcium levels in the urine because the kidneys are trying desperately to hang on to whatever calcium they can.
Makes sense.
And you'd likely see decreased levels of that active form of vitamin D, the 1025-dihydroxyvitamin D, because PTH is needed to make it.
Right, the activation step.
And ECG is also important, as we discussed, to look for that prolonged QT interval, that heart rhythm risk. And in some cases, maybe genetic testing if a congenital cause is suspected, particularly in kids or if there's a family history. And sometimes, though less common for diagnosis itself, brain imaging, like a CT or MRI, might be done, especially in chronic cases. It can sometimes show calcifications, little calcium deposits, in a part of the brain called the basal ganglia.
Calcification in the brain. Does that cause problems?
It can, especially if it's extensive. The basal ganglia are involved in controlling movement, so over time, these calcifications can sometimes contribute to movement disorders, like Parkinsonism-like symptoms.
Wow.